What if a virus carried silently by fruit bats could trigger outbreaks with mortality rates exceeding 70% and cause severe brain inflammation in humans? This is the reality of the Nipah virus. Nipah virus is one of the most dangerous emerging viruses identified in modern medicine. Although outbreaks remain relatively uncommon, the virus attracts significant attention from global health organizations because of its high mortality rate, its ability to infect multiple species, and its potential for human-to-human transmission. Nipah virus is an RNA virus belonging to the Nipah virus genus within the Paramyxoviridae family. Its genome consists of negative-sense single-stranded RNA, characteristic of its viral family. Its natural reservoir is fruit bats of the genus Pteropus, commonly called flying foxes. These bats can carry the virus without developing severe disease, allowing it to persist in nature. The virus was first identified in 1998 during an outbreak among pig farmers in Malaysia. Investigators discovered that fruit bats had transmitted the virus to pigs, which served as intermediate hosts. The pigs amplified the transmission to humans, causing the first major leap into the human population. Since then, outbreaks have occurred primarily in Bangladesh and India, showing a different pattern. Unlike the original Malaysian outbreak, several later outbreaks demonstrated direct human-to-human transmission. Humans can become infected through contact with infected animals or exposure to contaminated food. One well-documented route involves drinking raw date palm sap, contaminated by saliva or urine from infected fruit bats. After entering the body, Nipah virus infects endothelial cells lining blood vessels and respiratory tissues. It also targets cells within the central nervous system. This broad tissue tropism contributes to its severity. The incubation period usually ranges from 4 days to 2 weeks, though longer periods have been reported. Early symptoms commonly include fever, headache, muscle pain, sore throat, and fatigue. As infection progresses, neurological symptoms may develop rapidly, including confusion and dizziness. This can lead to seizures and encephalitis, which is severe inflammation of the brain. Many patients require intensive medical care because of this severe neurological impairment. In some outbreaks, respiratory disease has also been prominent, with patients developing a severe cough. This can lead to acute respiratory distress syndrome, making the clinical picture even more complex. Case fatality rates vary but have frequently ranged from approximately 40 to 75%. Among survivors, long-term neurological complications may occur, including persistent seizures and cognitive impairment. Rare cases of delayed or relapsing encephalitis have also been reported months or years after recovery. Currently, no licensed vaccine is available for routine human use, and no specific antiviral therapy is approved. Treatment primarily consists of supportive medical care, including respiratory support and intensive monitoring. Nipah virus remains on the World Health Organization's priority pathogen list for research and preparedness. Preventing outbreaks requires surveillance of animal reservoirs and reducing exposure to contaminated food. Rapid identification and strict infection control practices in healthcare settings are also vital. Nipah virus demonstrates how pathogens in animal reservoirs can emerge unexpectedly and threaten human health. Understanding these viruses before they spread widely remains a critical goal for modern public health.